The honourable member for Kitchener Centre has a right to reply.
Thank you, Mr. Speaker. Mr. Speaker, I would like to thank all the members in this House from all parties who spoke to M-132. As I said initially, the purpose of M-132 is to improve outcomes and increase public benefit resulting from federally funded health research. Mr. Speaker, while I am proud of the work that I've done on this motion, there are many others who have been working on improving Canada's health research regime for much longer than I have. And I know they stand ready to assist the Health Committee and the government as we move forward to improve health research here in Canada. I would like to thank, and I apologize to anyone that I may miss, Jack Nickerson from Doctors Without Borders, Rachel Kittle-Monroe and Chloe Hogg from Universities for Allied Medicine, Dr. Michael Clark from the University of Western Ontario, Richard Elliott from the Canadian HIV/AIDS Legal Network, Alison Krentel from the Breer Research Institute, Deb McFarland from Emory University, and Angela Quinlan, Marilyn Poulin, and Marguerite Keeley from the Grandmothers Advocacy Network, and also Healthcare Canada and the Health Charities Coalition of Canada, and all those working in health research here at home and around the world who have spoken to my team about health research and global health initiatives over the last year. It has been an honor to work side by side with them to ensure that people everywhere are supported by medicines and medical innovation. Some of the brightest minds of this generation are working tirelessly to eradicate disease, to find better treatments, and to advocate for policies which will lead to better health outcomes for all. These researchers and advocates deserve to be lauded, and the least that we can do as policymakers in this House is to ensure that they have the research tools in order to succeed. As we speak, Mr. Speaker, health researchers here in Canada are working to tackle antimicrobial resistance, playing a leadership role in a global effort to contain the threat posed by a generation of drug-resistant microbes. Canadian researchers are researching infection, healthy pregnancy, cardiovascular health, diabetes, respiratory health, cancer, tuberculosis, and obesity. They're also working on the latest preventative, diagnostic, and treatment approaches to neurodegenerative diseases causing dementia. Quite simply, Mr. Speaker, they're working on the treatments and cures which will make our families and our communities healthier. Taxpayers, researchers, and patients alike deserve to know that there is an efficient and effective system to ensure that the benefits of federally funded research reach those who need them the most. In the words of Andrew Petter, president of Simon Fraser University, innovation isn't a magic bullet. It requires a work plan. M-132 offers this House and our government the opportunity to step back and examine Canada's work plan. As we invest in science, strengthen health system, and set priorities for a generation of researchers, I hope that each member of this House will come together to commit to ensuring that policymakers have a firm grasp on Canada's research priorities and that Canada has the best research framework possible. Thank you, Mr. Speaker.
The question is as follows, Mr. Saini.